And let's now turn to health matters. The World Health Day is a global health awareness day celebrated every year on 7th April under the sponsorship of the World Health Organization as well as other related organizations. In 1948, the World Health Organization held the first World Health Assembly, which decided to celebrate 7th April of each year with effect from 1950 as the World Health Day. The day is held to mark WHO's founding and is seen as an opportunity by the organization to draw worldwide attention to subject of major global health each year. And for more on this day, Femi Oyekon, a medical doctor, joins me from Lagos via Zoom. Good to have you join us.
Yeah, you're welcome.
So we've been battling with a health crisis since 2020, and that's the coronavirus pandemic. While cases have dropped around the world, we're seeing resurgence of cases in some countries, and we're also seeing number of deaths also dropping as well. But as you look at all of this, especially also with the climate crisis, what exactly do you think is the biggest health challenge that we face today globally?
I'll say the biggest, first, thank you for making me part of this conversation. To your question, the biggest health challenges that we have this day, I know a lot of people possibly would think about, could it be coronavirus, possibly HIV may be high on the ladder, and in Africa, malaria is up there. But globally, I think it's the biggest crisis that we have is lack of credible will from the policymakers and policy implementers with regards to credible health policies that will eventually ensure that we and generations coming ahead are safe. So I think that's the biggest health challenge that we're facing now. Because if you look at the climate crisis, if you look at fossil fuel, we're not talking about new and renewable energy, and we're not look at how many numbers of deaths that coronavirus has claimed. If we have had credible policy in terms of how disease can be detected far before they become pandemic, things like the coronavirus and pandemic outbreak would not have left so many badly wounded and economic crippled globally.
And let's bring this back to Nigeria, because you are now, I mean, I've always spoken to you whilst you were in the UK, but you're here in Nigeria. There was a conference recently, I think it was put together by the Nigerian Medical Association, and there was a focus on medical tourism as well as brain drain in the health sector. You were here in Nigeria. What do you think that we actually need to fix? Because it is a challenge. A lot of people do not have health insurance. There is the issue of infrastructure. There's the issue of training and welfare of medical personnel. But for you, you've been here for some weeks or days, I assume. But what have you seen, and what do you think we need to fix in the health sector if we are to come to the place where we reduce the number of doctors and health officials who are leaving the country, and then we also retain a certain capital within the health sector in the country?
That's a very challenging question. But first, I must explain the fact that I'm still in the UK, but I think I visit Nigeria very often. No doubt, it's my home country.
But so I don't know how we got that you were in Lagos, but I guess we're projecting or predicting that you'll be in Lagos soon. So we're expecting you. But go ahead.
Yeah, I'll be in Lagos soon. To be very honest with you, in a couple of weeks, I should be in Lagos. But to come back to your questions about the Nigeria situation, it's going to be pretty difficult. I'll be very honest with you. I was trained in Ife, Obafemi Awolowo University. I did a few work in University of Lagos, and I will tell you that it's going to be difficult to have Nigerians that are medical doctors or medical experts to keep them in Nigeria. Let me give you my personal story. I used to work in Lut, and there was a time I was owed 7 months' salary, and I was a doctor. I was going back home to my parents to get food to eat and treat patients. Now, when the opportunity came to travel abroad, I didn't think it twice because I was going to be able to take care of myself and my family. So you can see this was my own situation, this in particular, and I know that several of my colleagues who have left the country had the same experience. So some even worse than my personal situation. So when you look at some of these things and you start saying that doctors going to or health professionals going to remain in the country, it's going to be difficult because what I earn here sometimes per day is more than what I was being paid per month in Nigeria. And I'm not joking. I'm saying this with a very huge sense of sincerity. So if you're now talking about trying to bring health expert back, I think it's going to be difficult. The only way I think that Nigerians, diaspora who are in the health profession can contribute is by exchange program. It is by exchange program. Yeah.
And Dr. Oyeko, I'm sorry to interrupt because I'm being told that my time is up. But you know, we are just talking. This is just one issue out of the very many issues in the health sector here in the country. Just welfare of doctors. We have not even talked about infrastructure and the whole health insurance scheme and all of that. But it is a huge challenge, and I hope that we continue to do all that we can to ensure things are done right within the health sector. Thank you so much for talking to us, Dr. Femi Oyeko.
You're welcome.